This is Chapter 4, Arousal, Stress, and Anxiety. Logan Tom was the USA Olympic volleyball coach in the year 2000 and 2004. When asked about his athletes, he once said, "People are a little nervous right now, but that can be a good thing. You can turn that anxiety into competitiveness on the court, and that helps out." History is full of athletes who have performed well under pressure, and also those who have performed exceedingly poor under pressure. So how does anxiety play a role in these outcomes? Sport and exercise psychologists have studied the cause and effects of arousal, stress, and anxiety in the competitive athletic environment and other areas of physical activity. Some people use the words arousal, stress, and anxiety interchangeably, but for this course we need to define and differentiate among these terms. Arousal is a general physiological and psychological activation that varies in intensity along a continuum. Highly aroused individuals are mentally and physically activated. They have increased heart rates, respiration, and sweating. Arousal is not automatically associated with either pleasant or unpleasant events. Arousal is generally a physiological and psychological activation that varies on a continuum from deep sleep to intense excitement. Stress is a substantial imbalance between physical and psychological demands that are placed on an individual and their response capability under conditions in which failure to meet demands has important consequences. Anxiety is a negative emotional state with feelings of worry, nervousness, and apprehension associated with activation of the body. Anxiety is often perceived as a negative factor. However, it does not always have to negatively affect performance. In the sports setting, anxiety refers to an unpleasant psychological state in reaction to perceived stress concerning the performance of a task under pressure. This is the interrelationships among arousal, trait anxiety, and state anxiety. Trait anxiety is part of a person. This is an acquired disposition that influences behavior. Trait anxiety predisposes an individual to perceive as threatening a wide range of circumstances that objectively may not actually be physically or psychologically dangerous. The person then responds to these circumstances with state anxiety, reactions or levels that are disproportionate in intensity and magnitude to the objective danger. States of arousal are generally physiological and psychological activation of the organism that varies on a continuum from deep sleep to intense excitement. State anxiety refers to the temporary, ever-changing mood component. This is defined more formally as an emotional state that's characterized by subjective, consciously perceived feelings or appreciation and tension, accompanied by or associated with activation or arousal of the autonomic nervous system. Cognitive state anxiety concerns the degree to which one worries or has negative thoughts. Somatic state anxiety concerns the moment-to-moment changes in perceived physiological activation. The relationship between trait and state anxiety. Trait anxiety is a behavioral disposition to perceive as threatening circumstances that objectively may not be dangerous, and then to respond with disproportionate states of anxiety. People with high trait anxiety usually have more state anxiety in highly competitive, evaluative situations than do people with lower trait anxiety. Antecedents of pre-performance anxiety. An antecedent is a thing or event that existed before or logically precedes another. So in this context, what factors affect pre-performance anxiety in athletes? These could include fear of performance failure and fear of the unknown, fear of a negative social evaluation, fear of actual or perceived physical harm, situational ambiguity, disruption of well-learned routines, and event importance. Stress and the stress process. You as a student are probably well versed in stress. We will review the definition of stress in the context of sport and exercise psychology. Stress is a substantial imbalance between physical and psychological demands that are placed on an individual and their response capability under conditions in which failure to meet demands has important consequences. Stress is a process or a sequence of events that leads to a particular end. Hans Selye, a medical doctor and researcher, found that when aroused, the body is under stress regardless of whether or not it is anger or joy. Eustress is moderate or normal psychological stress interpreted as being beneficial for the experiencer. Distress is extreme anxiety, sorrow, or pain when evaluated. Dr. Selye came up with the theory of General Adaptation Syndrome, or GAS. The General Adaptation Syndrome is a three-stage process that describes the physiological changes the body goes through when under stress. These changes do not occur in isolated incidents, but rather are a typical response to stress. These stages are alarm, resistance, and exhaustion. Understanding these different responses and how they relate to each other may help you cope with stress. McGrath proposed a model that stress consists of 4 interrelated stages, including environmental demand, perception of demand, stress response, and behavioral consequences. You can intervene during any of the 4 stages of the stress process or cycle. Stage 1 of the 4-stage stress process is environmental demand. Some demand is placed on an individual, either physiological or psychological. Stage 2 is the individual's perception of the environmental demand. This is when the individual's perception of physical and psychological demands is recognized. Stage 3 is the stress response, in which the individual's physiological and psychological response to the perception of a situation. Stage 4 is the actual behavior of the individual under stress. The final stage of the stress process feeds back to the first. The stress process is therefore a continuing cycle. Stress has a number of implications for practice. By understanding this cycle, we can target efforts and attempt to reduce stress. We can also incorporate stress management strategies for our participants. So how do arousal and anxiety affect performance? There are numerous theories that attempt to describe this relationship. One of the most compelling relationships that sport and exercise psychologists study is a relationship, either positive or negative, between arousal, anxiety, and emotional states on one hand and performance on the other. With numerous studies on these 2 factors, researchers have yet to come up with definitive conclusions between arousal and anxiety and its effect on performance. The drive theory. Psychologists first saw relationships between arousal and performance as direct and linear. The drive theory indicates that as an individual's arousal or state anxiety increases, so does their performance. This would suggest that the more psyched an athlete gets, then the better the athlete should perform. But we know intuitively that this is not necessarily true. An athlete or an individual can get so psyched for an event that their performance suffers. They may choke under pressure. Some of you may even have felt this with a big exam. You get so amped up before the exam and your state anxiety is through the roof. So how'd you do on that exam? Chances are you didn't do as well as you were hoping. At this point in time, there is little scholarly support for the drive theory. Another alternative to the drive theory is the inverted U hypothesis. The inverted U hypothesis explains the relationship between arousal states and performance. This view holds that at low arousal levels, performance will be below par. The participant is not psyched up. As arousal increases, so too does performance, up to an optimal point where best performance results. Further increases in arousal causes performance to decline. Most athletes and coaches accept the general notion of the inverted U hypothesis. However, despite acceptance on the hypothesis in general, it has recently been subjected to criticism. Some researchers have asked if this is really the correct shape for the curve. Does peak performance actually happen in the middle point of arousal for all time and all participants? Yuri Hani, a Russian sports psychologist, presented an alternative view called the Individualized Zones of Optimal Functioning, or IZOF. Hani suggested top athletes have a zone of optimal state anxiety in which their best performance occurs. Outside of this zone, poor performance occurs. This model differs from the inverted U theory, as the optimal performance zone isn't always in the middle range of anxiety. A person's zone for optimal functioning may be at the lower, middle, or upper end of the state anxiety continuum. Hani's eyes-off hypothesis does not address the component of state anxiety. This includes somatic and cognitive anxiety, which affect performance in the same way. The multidimensional anxiety theory predicts cognitive state anxiety, or worry, is negatively related to performance. Increases in cognitive state anxiety lead to decreases in performance. The theory predicts somatic state anxiety, which is physiologically manifested, is related to performance in an inverted U, and the increase in anxiety facilitates performance up to an optimal level, beyond which additional anxiety causes performance to decline. Research has not consistently supported this theory at this time. The catastrophe model predicts that psychological arousal is related to performance in an inverted U fashion, but only when an athlete is not worried or has low cognitive state anxiety. If cognitive anxiety is high or the athlete is worrying, the increases in arousal at some point reach a kind of threshold, just past the point of optimal arousal level, and afterward a rapid decline in performance is noticed. This is known as the catastrophe. Although some scientific support exists for the catastrophe model, it is very difficult to scientifically test or evaluate. The reversal theory suggests that the way in which arousal affects performance depends basically on an individual's interpretation of his arousal level. Arousal can be interpreted in one of two ways, either as pleasant or excitement, or as unpleasant and anxiety. If arousal is viewed as pleasant, then it facilitates performance, and vice versa. Reversal theory predicts that for best performance, athletes must interpret their arousal to be pleasant excitement rather than as unpleasant anxiety. Few research studies have tested the theory's predictions, so it's difficult to make assessments of the quality of this theory. For years, researchers have assumed that anxiety only had negative effects on performance. However, studies have demonstrated that an individual's interpretation of anxiety symptoms, either as positive and helpful to performance, known as facilitative, or as negative and harmful to performance, known as debilitative. Jones developed a model of how facilitated anxiety and debilitative anxiety interact. They suggest viewing anxiety as facilitative leads to superior performance, whereas viewing it as debilitative leads to poorer performance. State anxiety is perceived as facilitative or debilitative, and this depends on how much control the athlete perceives that they have. There has been some support for this theory. Performers can be trained to effectively use their anxiety symptoms in a productive way to develop a rational appraisal process in relation to their experiences during competition. There are no shortage of arousal performance views. Some things that we do know. Arousal and state anxiety do not always have a negative effect on performance, and interactions and interpretation of physiological and cognitive arousal are more important than the actual levels of each. How or why does arousal influence performance? Understanding why arousal affects performance can help us to regulate arousal. At least 2 things explain how increased arousal influences athletic performance. Stress increases muscle tension and causes muscle coordination difficulties. It is also known to cause attention and concentration changes. We see a narrowing of attention where we are unable to survey the entire playing surface. We see a shift to the dominant style of play, and a shift of attendance to inappropriate cues. This is a visual representation of attentional narrowing. This is the optimal attention field associated with moderate or optimal arousal levels. In a low arousal level, our attention field becomes extremely broad. And lastly, our attention field can become too narrow. We end up with what's called tunnel vision when an individual is in a state of high arousal. We can now integrate our knowledge of arousal, stress, and anxiety by applying it to our professional practice. 5 important guidelines include identifying optimal combinations of arousal-related emotions needed for best performance, recognizing how personal and situational factors interact to influence arousal, anxiety, and performance, recognizing arousal and state anxiety signs, tailoring coaching strategies to individuals. Arousal and state anxiety may need to be increased or decreased or maintained for different athletes. And we can also work to develop confidence. To accurately detect an individual's anxiety level, you must know the various signs and symptoms of increased stress and anxiety. To help us be able to describe arousal and anxiety, here's a short list of signs and symptoms. Cold and clammy hands, constant need to urinate, profuse sweating, negative self-talk, a dazed look in their eye, feeling ill or having a headache, feelings of apathy. Apathy is a lack of interest, enthusiasm, or concern. Cotton mouth or dry mouth. They're feeling constantly sick. They may even be nauseous. Difficulty sleeping. Increased muscle tension. Feeling of butterflies in the stomach. Inability to concentrate. And many individuals consistently perform better in non-evaluative situations. This is not a comprehensive list, but it can help to give you some examples. Like other behaviors, stress and anxiety can best be understood and predicted by considering the interaction of personal and situational factors. Importance is placed on performance, but not exclusively, and some certainty exists about the outcome. The interaction of personal factors, including self-esteem, social physique anxiety, and trait anxiety, and situational factors, including event importance and uncertainty, are better predictors of arousal, state anxiety, and performance than are either set of these factors alone. To wrap up arousal, stress, and anxiety, sometimes arousal and state anxiety need to be reduced and at other times maintained. Furthermore, sometimes we need to facilitate these factors in order for optimal performance.